Good morning, guys. Welcome to the vlog. This next week I am on the palliative care service. So I see patients whose prognosis may not be the best, and I discuss goals of care with these patients. So it could be something as minimal as using pressors, things like norepinephrine to help their heart beat at a regular blood pressure, or it could be more intense as CPR and as invasive as being intubated and put on a ventilator. So we discuss all of these things, and they make a decision. First, we have to check for capacity, check for understanding of the diagnosis and the prognosis, and then the final decision is made. It's not only that, it's also pain management for people who just want to be made comfortable. I saw 3 patients today, 1 patient with cancer, 2 patients with or who have had a stroke. There's 1 patient who wasn't confident that he had full capacity. There was a little bit of confusion, so decided to hold off on that. Have to tell the attending that I did that later, but it's, oh, I forgot I'm taking the stairs. But it's just because that you don't want someone making these end-of-life discussions or decisions when they're confused. You know what I mean? You want to make sure that person is fully with it before making a decision about their life.
If it's normal but blood pressure is still low, pressures.
So in palliative, when you're talking to the healthcare proxy, it's a lot about education. A lot of the general public doesn't understand what intubation is, what CPR is, medical management versus invasive procedures, and a lot of people don't understand that if you come to see your family member in the ICU and their chest is rising up and down, it's a machine doing that. They are not breathing on their own. I'm talking for like brain dead people or people in severe enough condition that palliative care is called, you know? So a healthcare proxy made a patient DNR, DNI, history of stroke in the past with a residual weakness, came into the hospital this time because of sepsis. It was an unknown cause. They're still working it out right now, the primary team, figuring out the source of infection. So someone on the primary team was talking to the family about their decision about DNR, DNI, and didn't explain it properly. You have to use very clear words when doing a palliative care discussion. Long story short, the family misunderstood feeding tube versus intubation, and they were saying, oh no, we want the tube, but without the clarification whether they mean feeding tube or intubation. So I was called today to talk to the family and explain in layman terms, clarify any questions, what actually happens with intubation and CPR. And they were like, oh yeah, we do not want that tube and the vent. They don't want them breathing on a machine. They don't want any of that. But if it comes to the point that she can't eat food orally, if she can't feed herself, they want a nasogastric tube specifically to go into her nose, down into her stomach, and she can receive food that way. I hope you guys can see from this video in particular why I'm not recording daily. Like, not a lot of fun and exciting things are happening in palliative care. Daily vlogs will be coming back when there's things to record. Like, I don't want to bore you guys with videos, you know? Thanks for watching. See you guys next time.